My name is Lisa Deaton. I am a Louisiana Nurses Action contributor and volunteer. Louisiana Nurses Political Action Committee is a non-partisan organization, and we are conducting interviews with candidates who are running for the state legislature. We want to learn more about where the candidates stand on issues that are important to nurses and to the health and welfare of our citizens. LANPAC solicited input from the nurses across our state, and then the Board of Trustees finalized the questions from the most important issues that were submitted. These questions were then sent to the candidates who agreed to be interviewed. I am delighted to welcome Representative Dodie Horton, who is running for the election for re-election in District 9 and for our state legislature. Welcome, Representative Horton.
Thank you so much, Lisa, and thank you for having me. I really appreciate you and all of our dedicated, loyal nurses, because I go to a nurse practitioner by choice, and because I have full confidence in her knowledge and understanding, and never worry about any of our nurses practicing outside their scope. That's why my voting record reflects that. After serving 8 years in the legislature, I've learned so much about the nursing profession, and I pray that I have represented you well. And so, running for re-election for my last term, I look forward to a continued working relationship, and I would appreciate any support that you can give. But there's a lot to learn. I'm always anxious to learn what I can do to help, because your profession is so complex. You're asked to do so many things and take on all the liability for it. I can't imagine how stressful it is when you have life and death in your hands. And so I really appreciate y'all, truly.
Well, thank you. So we're going to go ahead and move into the questions. And question 1 is, prior to COVID, we recognized healthcare services and the accessibility to services were not on an equitable basis, nationally or in Louisiana. So healthcare is only 20%, though, of what accounts for one's health status. And the social determinants of health are the non-medical factors that influence health outcomes. What strategies do you have to assist with reducing social determinants of health impact on our citizens?
I believe that in the past, I voted for legislation that really provides incentives for our people who are on any one of the Medicaid plans to go to their visits, and to utilize their their nurse practitioners and the I guess their regular doctor, instead of using the emergency rooms for that. And I believe that if we could just continue to steer our people towards these clinics. In fact, I'm thankful for the clinics that stay open after hours. I find that a lot of these working parents have to take their children. They're at the emergency room because that's the only time they can go to have their well visits. So I've noticed that different offices have open later on certain days of the week to be able to accommodate that, to lessen the strain a general visit is on the emergency rooms. But I always listen to you, the experts, and the expert take that advice on what we can do to help you accomplish our goal, and that's making sure that everyone in Louisiana has access to good health care. Next question.
Okay. Our next question has to do with faculty shortages and higher education with nursing. How would you advocate for federal and state funding to support recruitment and retention of nursing faculty to reduce the nursing shortage?
Nursing shortage is critical, and like you said, but we can't retain great teachers without being competitive. So we have to find a way to raise the amount that we pay in order to be competitive, to keep you guys here, and to maybe get our retired professionals to come back and teach. We have to make it worth your while. And so I believe we have to update the service delivery model, one for the Department of Health, something we haven't done since Huey Long laid that foundation in 1932 or 33. And in order to do that, part of that reassessment is looking for new ways of funding, but it's prioritizing all of the programs that we have, eliminating the ones that don't work but still receive funding, the ones that do not produce the desired results for our citizens, and then to put that money towards programs that do work. And we could free up hundreds of thousands, millions of dollars actually to be able to put that towards nursing and instructing. Because Department of Health, last I looked, I believe it was over $15 billion a year budget for Louisiana. And we're last in the nation as far as our outcome. It's not our nurses, our doctors, it's not our employees, it's our system. And that's why we must update that to better serve our people and to utilize those funds in a more productive way. And that would open up so much money to be able to be competitive and to appropriate towards the nursing profession and the teaching professionals. So, next question.
Okay. Our next question is related to safety and violence. We know gun violence continues to roar through our communities. Schools, house of worship, shopping malls, grocery stores, just anywhere it seems like gun violence is on the rise. What factors do you see as critical to bringing an end to these senseless acts? And do you have any strategies to address those problems?
We know mental health is at a crisis level in all walks of life. And I believe that attributes to the overwhelming amount of gun violence that we're seeing. And like you said, in all the places that you can go to that you can have a mass shooting, they are having those, and with law enforcement, we were talking about 93% of all violent crimes on a mass level, they start if they're at gun-free zones. So I believe the best way to address that is to allow the right people to be in place to protect our professionals while they're at work. And so doing away with gun-free zones for the professionals to be able to be there and be employed there, which I know they can, but when you put up something that says, and I know this may be controversial to some, but that's a statistic, that gun-free zones open the door for people who might want to commit mass murder to come in knowing that they're not going to be faced with any opposition. But really, to me, the key is being able to treat our citizens for the mental health issues that they have. Will we ever eliminate the threat? No, because man is always is complex and is prone to violence, unfortunately. And but I do believe, as you know, that our mental health crisis is at an all-time high. Our opiate addiction, now fentanyl, that we passed legislation to try to address. All these factors bring in instability. And so we passed laws to help with violence in the workplace. And for our educators and for at the hospitals, we passed that. But can we pass enough laws to stop this type of violence? I don't believe so. I believe it's in the individual. If we could somehow catch them before they get to that point, it's mind-boggling. I personally am not one that has all the answers, but I'm certainly willing to continue to explore what they may be to help deter it. I believe deterring it is the best way to eliminating it somewhat. Next question.
Okay. Well, you mentioned fentanyl. Rapid fentanyl test strips can be used to determine if drugs have been cut with or mixed with fentanyl. With important information about fentanyl, healthcare providers can take steps to reduce the community's risk of an overdose. How would you support legislation to make rapid fentanyl test strips more readily available?
I'm glad you asked that question because I didn't know about these test strips until this past session where I served on Criminal Justice Committee. That's when I really learned about what's available to stop our citizens from overdosing. I didn't realize how toxic fentanyl is. If someone's holding their child while they're cooking it and they walk just through the smoke, it kills that child instantly. It's so deadly. And so I believe that our return on our investment to be able to provide these test strips is huge. If we could save one life by providing these test strips for our citizens, I think it would be something we can't say no to. Again, money's not the issue in Louisiana. It's to what we prioritize and how we spend it. And that would be a critical point of action, I believe, that we should make sure that they're available. I just want to see people live. And I know you do too. And with this new influx of fentanyl, even though we passed laws, you know, for the criminal side, for the addict side. We just, like you, want to save their life. And if that test strip will do it, then let's give it to them. And we should have it shouldn't be hard to find the funds to do that.
Great. Okay.
So,
Are you supportive of actions to remove arbitrary barriers that prevent all healthcare practitioners, including advanced practice registered nurses, from practicing to the full scope of their education, licensure, and training?
absolutely. I've proven that with my voting record. I do. I don't like layers of government that get in the way of production and get in the way of our citizens accessing all different things in life. We always have this middle layer we have to get through, and people get tired. If it's too complicated, too difficult, they're not going to go. And so if we could take away the barriers that allow you to do what you do and practice freely and to the full extent of your scope, that's a no-brainer to me. And that opens up, like we talked about, that critical health care that our citizens, especially in rural areas, will be able to have access to. You know, it's my understanding, and I learned this in the legislature, a doctor never looks at a file. They never go and check up on the nurse practitioner or what profession that's under their umbrella. All that the nurses do is pay a fee. Now, so the physicians opened the door to me to allow the nurses, nurse practitioners and all, to be able to do their job and practice to their full scope without any, because there is no oversight at all anyway. So you know what I'm trying to say? I hope I'm saying that correctly. You're paying something monthly to be able to operate under that physician's name and name only. So that tells me the physicians aren't worried about the nurse practitioners and doing their job. They're not worried that they're going to practice outside their scope because they don't darken the doors. So I too have full confidence that they need to be able to be free to operate for the full scope of their practice. I totally support that.
Okay. Well, our last two questions are more of a general nature. We would like to know what your legislative priorities are for this last term if you're reelected.
Well, when I'm reelected, Lord willing, I really, I know that my priorities, I think number one, we have to address crime in Louisiana. When we have 3 of the cities in our state, they're in the top 10 most violent cities, we have to address that. Which, and when we do, we'll be able to hopefully lower our insurance rates, which are out of this world. Everyone knows Louisiana pays a high cost for automobile insurance and now homeowners. So we must address that. But crime, when you have over 4,000 carjacking and car violence in New Orleans alone within that last 8 months, there's not an insurance company that wants to come and to come into our state to do business. They're too afraid of what the cost will be to them. So we have to take away those obstacles. So lowering insurance rates for our citizens. And then again, when I mentioned education, and we've got to educate more on nursing. We have to and provide more technical training for our citizens who don't want to go to a 4-year college, but because we desperately need a workforce. Like you said, our nurses, RNs, our LPNs, and people who take, CNAs, is that correct?
Yes.
We need all aspects of the profession, the medical profession. We need to open up those doors, and I know that we have ways to do that. We have the Louisiana Promise that 27-year-olds and above can take advantage of to go back and to further their certifications and knowledge to be able to raise themselves up financially. So education is key to me to improving our output on that. And tax reform, we'd like to try to eliminate the state income tax. It's a very difficult thing to do with the generous homestead exemption that we have. And so we'd like to do it responsibly, but it'd take about 3 years to do that, but I think it can be done. So we have a hope of becoming a business-friendly state again, to deregulate, to take away some of the burdens that we placed on business, and to encourage entrepreneurship, which we do not do. It's very difficult for someone to start a new business. They have so much hoops they have to jump through. So, just things like that, I believe will be able to turn our state around and we need to do a 180. But we need to support our people in whatever their desire to do. We need to be there to support them, enable them to have the tools to do that. And the lawmakers have to be able to look at what is in the way, what is burdensome, and to amend those laws to make them to where it just flows. So.
Very good. Okay. So the last question is, why should the Louisiana nursing community support you as the best candidate for District 9?
I have a proven track record. I'm not someone that's saying what I will do. I've never made a commitment that I didn't stand by. If I didn't understand something, I would go to people with boots on the ground. Like I said, my legislative assistant's a retired nurse. And so she really is able to explain to me what you go through day by day. I have a friend that's she's a nurse practitioner, have a family member that's is a physician assistant. And so we have a gamut. I have several doctors in the family. So we have a lot of spirited debates about, the scope of practice, but they support you. They even got kind of reprimanded when they came out in support of the bill that was carried that I supported to allow you to practice to the full scope of your practice. So I believe I'm the only one in this race that you can look at my record and know exactly how I'm going to vote and what topic. And sometimes, during this course of 8 years, I started out not supporting, medical marijuana to the point that we have now. Medical marijuana has been illegal in Louisiana since 1979, but we never had given access or had a way to get it to the people. But when I first got in office in 2016, my constituents did not support it. But after learning from the people in Colorado how it helped, our position changed, as did mine. So we are always open-minded, because I want to learn, I want to see, and I want to share with my constituents what we're looking at in the full gamut of any issue. And so I'm always open-minded, but I'm really steady. I'm a steady person that you can count on. So, and again, I believe you can look at my voting record and see that. So I would be honored to have your support, and regardless, I'm going to continue to work with you and for you. So thank you for letting me speak today.
Oh, thank you for agreeing to be interviewed. We really appreciate it. And what we'd like to do now is give you a couple of minutes for any closing comments, any issues that you may not have covered in the questions, just anything you would like to tell us.
Oh, thank you so much. I just want everybody to understand that I'm just a regular Joe representing regular people like me. And I just, I've never not represented the people. I'm not a big government person. I represent people, and my district always comes first. I know I never compromise on our core values. Sometimes government can criticize you for that, but I don't serve government, and I serve, and that's why I believe that I always have an ear to the people with boots on the ground. I want to know how a certain law is going to affect the lives of the people who do this every day. And so that is who I am, and that is who I'll continue to be. And I do appreciate your consideration.
Okay. Well,
thank you
very much.
Thank you.
Like I say, I appreciate that you were willing to do this for us, and good luck with your reelection.
Thank you. God bless you for what you do.